بسم الله الرحمن الرحيم وبه نستعين. اللهم صل وسلم وبارك على سيدنا محمد وعلى آله وصحبه أجمعين. I am د.انصاف ابراهيم حسين الشمري, lecturer in Department of Pharmacology, College of Medicine, Anbar University, Iraq. My lecture in pharmacology for third stage students. Our lecture today, Cephalosporins. The class of cephalosporins is cell wall inhibitor. Cell wall inhibitors. Some antimicrobial drugs selectively interfere with the synthesis of the bacterial cell wall. The cell wall of bacteria is composed of a polymer called peptidoglycan that consists of glycan units joined to each other by peptide cross-links. Thus, the peptidoglycan is the important substance in the bacterial cell wall. To be maximally effective, inhibitors of cell wall synthesis require actively proliferating microorganisms. Thus, they have little or no effect on bacteria that are not growing and dividing. So, to produce a maximum effect from these antibiotics, we need bacteria that are in growing and dividing or in a proliferating condition. Cephalosporins, they are beta-lactam antibiotics. First of all, the chemical structure of cephalosporin. Cephalosporin, they are beta-lactam antibiotics that are closely related both structurally and functionally to the penicillin. So, the cephalosporins and penicillins are similar in structure and function. Most cephalosporins are produced semi-synthetically by chemical attachment of side chains to 7-aminocephalosporinic acid. Cephalosporins also have the same mode of action as penicillin. Thus, the penicillin and cephalosporins are similar in structure, function, and mode of action, and they are affected by the same resistance mechanisms. However, they tend to be more resistant than the penicillins to beta-lactam lactamases. Antibacterial spectrum of cephalosporins. Cephalosporins have been classified as, before talking about antibacterial spectrum, we must do about the classification of cephalosporins. The cephalosporin have been classified as first, second, third, and fourth generation. The classification of cephalosporin based on their bacterial susceptibility patterns and resistant to beta-lactamases. So the classification depends on two factors. Number one, bacterial susceptibility patterns. Number two, resistant to beta-lactamases. Cephalosporin are ineffective against methicillin-resistant Staph aureus. Also, Listeria monocytogenes, Clostridium difficile, and the enterococci. Here we are talking about first generation of cephalosporin. Involve cephalexin, cefazolin, cephalorphin, and cefadroxil. These drugs are very active against gram-positive cocci bacteria, including staphylococci, streptococci, and pneumococci. Also, they are resistant to the staphylococcal penicillinase and also have activity against gram-negative rods, mainly Proteus mirabilis, E. coli, and Klebsiella pneumoniae. Cefazolin finds application as a single prophylaxis dose prior to surgery. Because, why? Because of its half-life and its activity against penicillinase producing Staph aureus. So, use cefazolin prior to surgery as a single prophylaxis dose prior to surgery. Also, cefazolin is effective for most surgical procedures, including orthopedic surgery, because of its ability. This drug has the ability to penetrate bone. So, cefazolin can use in a single prophylaxis dose prior to surgery because of half-life and its activity against penicillinase producing Staph aureus, as well as cefazolin also used for most surgical procedure in orthopedic. Why? Because this drug has ability to penetrate bone. Second generation of cephalosporin involve cefaclor, cefoxetine, cefuroxime, cefamandol, cefotitan. The second generation cephalosporins have greater activity against 3 additional gram-negative organisms, such as H. influenzae, Enterobacter aerogenes, and some Neisseria species, whereas activity against gram-positive organism is weaker. The exception to this generalization is cefoxetine, which has little activity against H. influenzae, yet is effective against the anaerobic Bacteroides fragilis. Thus, cefoxetine is useful in patients with intra-abdominal sepsis and pelvic inflammatory disease, while cefuroxime has a longer half-life and crosses the blood-brain barrier. So it can be used for acquired pneumonia. Cefuroxime, due to longer half-life and crosses the blood-brain barrier, thus it can be used for acquired pneumonia. Third generation of cephalosporins involve cefotaxime, ceftriaxone, ceftazidime, cefoperazone, ceftizoxime, cefixime, and cefixime. The major features of these drugs are their gram-negative coverage and the ability of some to cross the blood-brain barrier. Although inferior to the first generation cephalosporin in regard to their activity against gram-positive cocci. Cephalosporins have the third generation enhanced activity against gram-negative bacilli, as well as most the enteric organism plus Serratia. Also, ceftriaxone or cefotaxime have become a drug of choice in the treatment of meningitis. So, ceftriaxone or cefotaxime considered as a drug of choice for treatment of meningitis. Ceftazidime, while ceftazidime has activity against Pseudomonas aeruginosa. Ceftriaxone has the largest half-life of any cephalosporin, is 6 to 8 hours. which permits once a day dosing, and it is effective against penicillin-resistant Neisseria gonorrhea. And this drug is excreted in bile. It has a good penetration into bone, while cefixime is administered orally once daily. Fourth generation of cephalosporins involve cefepime. Cefepime is classified as a fourth generation cephalosporin and must be administered parenterally. Also, cefepime has a wide antibacterial spectrum, being active against streptococci and staphylococci, but only those are methicillin susceptible. Also, cefepime is also effective against aerobic gram-negative organisms such as Enterobacter, E. coli, Klebsiella pneumoniae, Pseudomonas aeruginosa. So, cephalosporin can be classified into four generation: first, second, third, and fourth generation. Here we are talking about resistance of cephalosporin. Mechanisms of bacterial resistance to the cephalosporin are the same as penicillins, although they are not susceptible to hydrolysis by the staphylococcal penicillinase. Cephalosporin may be susceptible to beta-lactamases extended spectrum. Resistant to cephalosporins are involved natural resistant and acquired resistant. The natural resistance to these drugs occur in organisms that either lack of peptidoglycan cell wall, for example mycoplasma, or have cell wall that are impermeable to the drug, result in resistant to cephalosporins. Acquired resistance to the cephalosporin by plasmid transfer has become a significant clinical problem. Why cause significant clinical problem? Because an organism may become resistant to several antibiotics at the same time. Organism may become resistant to several antibiotics at the same time, result in a significant clinical problem. Acquired resistant involve lactamase activity. This family of enzyme hydrolyze the cyclic lactam ring, which cyclic beta lactam ring, which amide amide bond of the drug, result in loss of bactericidal activity. Lactamases are either constitutive or more commonly are acquired by the transfer of beta-lactam antibiotic plasmid. Some of the lactamases and are poor substrates for resist cleavage. Beta-lactamases, gram-positive organisms, secrete extracellularly, while gram-negative bacteria have the enzyme in the periplasmic space between the inner periplasmic space between the inner and outer membranes. Other acquired resistance due to decreased permeability to the drug, decreased penetration of the antibiotic through the outer cell membrane, this prevents the drug from reaching the target. As well as the presence of an efflux pump can also reduce the amount of intracellular drug. Pharmacokinetic of cephalosporin include administration, distribution, metabolism, and excretion. Administration of cephalosporin. Many of the cephalosporin must be administered intravenous or intramuscular. Why? Because of their poor oral absorption. Poor oral absorption. So administered cephalosporin by intravenous or intramuscular. While cephaloxime, cefadroxine, cefaclor, and cefixime are administered orally. 2. Distribution. All cephalosporins distribute very well into body fluids, and all cephalosporin cross the placenta. Fate of cephalosporin. Elimination of cephalosporin occurs through renal routes by tubular secretion and or glomerular filtration. Therefore, doses must be adjusted in patients with severe renal failure. Ceftriaxone is excreted through the bile into the feces. So, cephalosporins excretion through renal route, while ceftriaxone is excreted through the bile into the feces. Adverse effects. Number 1, allergic manifestation. The cephalosporins should be avoided or used with caution in the individual who are allergic to penicillins. 5 to 50% show cross sensitivity. In contrast, the incidence of allergic reaction to cephalosporins is 1 to 2% in patients without a history of allergy to penicillins. Number 2 of side effect, disulfiram-like effect. When cefamandole, cefotetan, or cefobirazone is ingested with alcohol, a disulfiram-like effect is seen. This occurs because they block the second step in alcohol oxidation, result in accumulation of acetaldehyde. The toxicity is due to a presence of methyl thiotetrazole or MTT group. So the toxicity is occurred due to a presence of MTT group. Number 3, bleeding. Bleeding also associated with agents that contain the MTT group, because of this group act as anti-vitamin K effect. And the vitamin K is the important vitamin which play a role in the formation of many clotting factors. So when the MTT group act as anti-vitamin K effect can cause bleeding. Also here in disulfiram-like effect, when cefamandole and cefotetan or cefobirazone is ingested with alcohol, disulfiram can occur by block the second step in alcohol oxidation, result in accumulation of acetaldehyde. And this toxicity is occurred due to the presence of the methyl thiotetrazole or MTT group, as well as this MTT group also can cause hematological side effects such as bleeding, and this why this occur? Because MTT group act as anti-vitamin K. Thank you.